Good morning, everyone. So today I'm going to take you into a brief summary of how to use the WebV, mainly for doctors who work in the A&E department, Lincoln County Hospital. First of all, you need to find the icon of the WebV from the desktop. Then you will use your own logins and password to log into the WebV program. So after login, you would see a picture like the picture shown on the right hand side. So first thing to do is that you minimize your research by selecting the site, which would be inpatient WebV, and select the location, which would be the emergency department or A&E. After that, it would show you a list of the patient names beside it, their NHS number, and admission date, clinician looking after them, and location specifically in A&E, either majors, minors, waiting room, beads, or resus, for example. Alternatively, you can directly search a patient by clicking on the tab Direct Search and Favorite Patient and inserting his or her NHS number, and the patient name will pop out for you on the right-hand side blank list. So after clicking on the patient name, another screen will pop out for you showing some details about this patient. So first thing we would usually do in A&E is to order some bloods for the patient. So I'm going to walk you through how to do this. So ordering a blood test for a patient, after selecting the patient, we go to the main menu, patient menu, then you would go request and referrals. This will pop out either blood science, microbiology, or radiology. Usually these three things we mainly use in A&E as an investigation tools for the patients. So for now we will go for the blood sciences. So after pressing blood sciences, this is the screen that will pop out for you. You would find the details of your patient mentioned in the first line, usually the name, NHS number, date of birth, and the gender. After that, in the second line, you would see selecting the clinician, selecting the location, and how urgent is the blood test. So first of all, you will choose the clinician name. This would usually be the consultant name. And after that, you will choose the location, A&E Lincoln. And usually you tick urgent request. After doing so, it will pop out for you a number of ready chosen conditions like abdominal pain, acute admission profile, delayed poisoning, GI bleed. Once you choose one of these conditions, the system will automatically select a set of investigations and they would be shown on the right hand side as the ordered test. If you would like to pick your tests individually, you can choose from the full test list or from the most popular tests. Finally, after pressing print, there would be two dialog boxes which would pop out as shown on the left hand side. One of them will ask about the collection date and time, either now, later today, or in a future date, and you will choose now and print. And finally, they will ask one last time for making sure that all the information you have provided is accurate. And after pressing OK, a blood form will pop out for you as shown on the right hand side, confirming the details, blood requested. And when you press print on this form, it will automatically request from the selected printer on the system to print the blood form for you. One extra tip to add a blood for a patient after already sending the bloods. So you would choose the patient that you would like to add for him or her the bloods, as we have shown earlier how to select the patient. After that, you would go on the upper right hand side on the action menu button. After pressing on it, it would show one of the options as order extra test, and usually you would find this screen showing up on the right hand side with the extra tests that you can add. If you didn't find your tests in these lists, then you might need to contact the blood science lab for advice regarding the intended added test. Now, regarding reviewing the bloods for your patient, again you will choose the patient as we discussed earlier. After that, you will press on blood science as shown with the blue arrow on the left hand side, and after that the results will pop out for you. One more trick, if you would like to review the previous bloods, for example, to know about what's your patient baseline, for example, for his kidney function, is the numbers shown today is something new or acute, or that's the baseline for the patient, you can simply use the icon indicated with the red arrow on the right hand picture to review a list of the patient previous bloods that have been done, so that you can have an idea about what might be going wrong, or is this change something new to the patient, or that's his baseline. Now let's see how we order a microbiology test. So usually, again, we choose the right patient first. After that, we go to the main menu, patient menu, request and referrals, and we choose this time microbiology. After that, it will pop out a screen as shown in the lower picture. You will choose the relevant investigation, and after that you would press print. Mainly we use microbiology in A&E to request blood cultures and urine culture for people or patients that we are suspecting sepsis. To review a microbiology test results, again, as we can see on the left hand side, first of all you choose your patient. After that we go to the main menu, patient records this time, not requests, and after that we choose microbiology table. Then another screen like the one shown on the right side will pop out for you, giving you all the previous microbiology tests with the collection date, specimen and specimen number and specimen type, the type of investigation and the results, and if there is any advice regarding the antibiotic use for the patient. One more thing you need to know how to order is ordering a scan. Again, first of all, you make sure you choose the right patient as we mentioned earlier, and from the main menu you go for patient menu. After that, going for requests and referral, and pick radiology. A screen like the one shown in front of you will pop out, where you would choose the modality of the scan, either plan X-ray, CT, MRI, etc. And after that, you will also choose the relevant consultant, location and mobility status of the patient, Also, they will ask you to include few clinical relevant details about your patient and why you need this scan and what you are suspecting as a provisional diagnosis. Any CT scan will need to be vetted by the on-call radiology before it can be performed. Within few exceptions, like the CT head scans, usually you don't need to vet the CT head if the criteria for a CT head scan is met. And finally, you would, after selecting the examination type and area, you will just click on the green button down on the right hand side, which mentioned proceed to safety declaration form. It will take you to another tab where you would need to answer a couple of questions. For example, if the patient is pregnant, does the patient have like a pacemaker? Is the patient having any infectious disease? After answering these couple of questions, then the form would be accepted.